Welcome back to Sleep Medicine and Physical Therapy. Today we're going to start part 7, the last part, which is Sleep Assessment for Physical Therapy Clinical Practice. Today's topic is Subjective Assessment of Sleep. I'm Chris, physiotherapy student. The intention of sleep assessment is to provide sufficient and accurate data to determine treatment. Accurate sleep assessment is the first step in effective sleep management by the physio. Information on the nature of sleep disturbance, physiologic, behavioral, and emotional aspects, as previous experiences with sleep, are crucial for the beginning of the treatment and for managing the treatment. Valid and reliable measurements of sleep are needed to identify patients who require intervention and to evaluate the effectiveness of an intervention. A detailed anamnesis includes an assessment of numerous variables that may interfere with sleep and may play critical roles in the sleep management. Patients' characteristics such as age, gender, ethnicity, profession, and marital status should never be missed in the assessment. It is interesting to have height, weight, and measures of the neck and abdominal circumference. And now we're going to talk about some key questions regarding sleep-related issues and disorders. Sleep routine, time of going to bed and waking up. Quality of sleep, non-restorative or unrefreshing. Difficulties falling asleep, staying awake during the night. Number of hours of sleep refreshes versus number of sleep that really sleeps. Adequate opportunity to sleep. Somnolence during the day. Tendency to nap easily during the day. How and when sleep disturbance or complaint started. Fragmented sleep, how many awakenings. Tendency to snort or choke during sleep. Tendency to stop breathing during sleep. Witnessed apnea, lack of breathing or choking. Grind teeth during sleep. Wake up during the night due to which reason. In which position do you sleep? Tendency to go to the bathroom or toilet during the night, how many times nocturnia? Do you move a lot during the night? Environmental questions, how is your bedroom? Cozy, warm, blackout curtains, loud, disruptive snoring? Medications that can interfere with the sleep. History of appearing to act out one's dreams, such as punching or flailing arms in the air, shouting or screaming. Tendency to experience unpleasant, nervous, creepy, crawly sensations in the leg or feet, primarily at night or when sitting at rest, and urge to move the legs, and the tendency for the unpleasant sensations to temporarily be relieved by moving the legs or walking. A propensity for the legs to periodically jerk during sleep. Propensity to experience cramps during sleep. Tendency to struggle falling asleep before 1 hour and 3 hour marks, and tendency to awaken after 8 hour mark in the morning. Propensity to struggle to maintain wakefulness prior to 8 hour in the evening, and the tendency to awaken earlier than 6 hour in the morning. If the anamnesis of the physio suspects of any symptom or disease, questionnaires to evaluate them should be included, aiming to help within the clinical picture as the diagnosis is performed by the sleep specialized physician and to monitor the treatment. For the evaluation of general health, the Pittsburgh Sleep Quality Index is one of the most used in the research and clinical practice assessing sleep quality. PSQI is an extensive questionnaire on the behavior of sleeping times and problems. In respect of disease-specific instruments, there are many designed to assess specific conditions of the disease itself. For the sleepiness evaluation, there are some assessment tools such as the Epworth Sleepiness Scale, the Stanford Sleepiness Scale, which help assess the impact of sleepiness on the ability to conduct daily activities. For insomnia, the Insomnia Severity Index, the Athens Insomnia Scale, and the Insomnia Symptoms Questionnaire are among the most used questionnaires designed to establish a clinically relevant case definition of insomnia consistent with widely used insomnia classification criteria. For sleep and pain, there are two questionnaires. One is a pain and sleep questionnaire, 3-item index, a direct measure of the impact of chronic pain on sleep, and the chronic pain sleep inventory, a 5-item tool using a 100mm visual analog scale. There is also a neo measurement tool specifically designed and evaluated for older adults, which is the sleep assessment instrument for older person in pain. To assess circadian preferences, that is, whether a person's circadian rhythm or biological clock produces peak alertness in the morning, evening, or in between. The morningness eveningness questionnaire, which helps to determine individual differences in sleep-wake patterns and the time of the day people feel and perform best, can be used. The second questionnaire, which is the Munich chronotype questionnaire, can assess individuals' chronotypes, their early preferences that manifest in personal sleep-wake rhythms. The sleep diary. The sleep diary is a record of an individual's routine of sleeping and waking times. It can be fulfilled by the proper patient, by a caregiver, or by the parents. The sleep diary records the subjective perception of the sleep period and can be recorded for at least 10 days, in order to include weekdays and weekends, or more depending on the case. Often patients record information such as the time the patient went to bed, number of times patients awoke during the night, how refreshing overall sleep was, etc. It is a self-report measure in which patients and participants record their sleep patterns and answer other questions related to their sleep on a daily basis. Sleep diaries capture night-to-night variability in sleep. It is particularly important for assessing sleep routine for the physio and the patient, as they can have a better idea of the patient's sleep patterns and habits, and can help with the physician with a diagnosis, and also can monitor the effectiveness of treatment. In addition, the sleep diary may help the patient to get more proactive about their sleep, knowing it better. Henceforth, it's the best practice to include both subjective and objective measures when examining sleep. General instructions include how often and when to fill out sleep diary. It is necessary for the patient to complete the sleep diary every day. If possible, the sleep diary should be completed within 1 hour of getting out of bed in the morning. As for the nighttime sleep diary, you can complete the questions before you go to bed at night. While answering the questions make the patient's sleep more difficult, It's not usually the problem, and so you should not be worried about giving exact times and should not have the clock watch, and just give the best estimate. The morning sleep diary item instructions. Use the guide below to clarify what is being asked for each item of the sleep diary. Date. Write the date of the morning you are filling out the diary. What time did you get into bed? Write the time that you got into bed. This may not be the time you began trying to fall asleep. What time did you try to go to sleep? Recall the time that you began trying to fall asleep. How long did it take to fall asleep? Beginning at the time you wrote in question 2, how long did it take to fall asleep? How many times do you wake up, not counting your final awakening? How many times did you wake up between the time you first fell asleep and your final awakening? In total, how long did these awakenings last? What was the total time you were awake between the time you first fell asleep and your final awakening? For example, if you woke 3 times for 20 minutes, 30 minutes, and 50 minutes, you add them all up to like 70 minutes. What time was your final awakening? Record the last time you woke up in the morning. After your final awakening, how long did you spend in bed trying to sleep? After the last time you woke up, how many minutes did you spend in the bed trying to sleep? For example, if you woke up at 8 a.m. but continued to try to sleep until 9 a.m., record 1 hour. Did you wake up earlier than you planned? If you woke up or were awakened earlier than you planned, check yes. If you woke up at your planned time, check no. If yes, how much earlier? If you answered yes to the previous question, write the number of minutes you woke up earlier than you planned on waking up. For example, if you woke up 15 minutes before the alarm went off, record 15 minutes here. What time did you get out of bed for the day? What time did you get out of bed with no further attempt at sleeping? This may be different from your final awakening time. For example, you may have woken at 6:35 a.m. but did not get out of bed to start your day until 7:20 a.m. In total, how long do you sleep? This should be your best estimate based on when you went to bed and woke up, how long it took you to fall asleep, and how long you were awake. You do not need to calculate this by adding or subtracting, just give your best estimate. How would you rate the quality of your sleep? Sleep quality is your sense of whether the sleep was good or poor. How restful or refreshed did you feel when you woke up for the day? This refers to how you felt after you were done sleeping for the night during the first few minutes that you were awake. Nighttime sleep diary item instructions. Complete the following items before you go to bed. Dates. Write the date of the evening you are filling out the diary. How many times did you nap or doze? A nap is a time you decided to sleep during the day, whether in bed or not in bed. Dozing is the time that you have nodded off a few minutes without meaning to, such as watching TV. Count all the times you napped or dozed in time from when you first got out of bed in the morning until you got into bed at night again. In total, how long did you nap or doze? Estimate the total amount of time you spent napping or dozing in hours or in minutes. For example, if you napped twice, once for 30 minutes and once for 60 minutes, and dozed for 10 minutes, you should answer an hour and 40 minutes. If you did not nap or doze, write not applicable. How many drinks containing alcohol do you have? Enter the number of alcohol drinks you had, where one drink is defined as 1 12-ounce beer can, 5-ounce wine, or 1.5-ounce liquor. What time was your last drink? If you had an alcohol drink yesterday, enter the time of the day in hours and in minutes of your last drink. If you did not have a drink, write not applicable. How many caffeinated drinks, coffee, tea, soda, energy drinks, do you have? Enter the number of caffeinated drinks you had, where the coffee or tea, one drink equals to 6 to 8 ounces. While the caffeinated soda drink, one drink is 12 ounces. What time was your last drink? If you had a caffeinated drink, enter the time of the day in hours and in minutes of your last drink. If you did not have a caffeinated drink, write not applicable. Did you take any over-the-counter or prescription medications to help you sleep? If so, list the medications, dose, and time taken. List the medication name, how much, and when you took each different medication you took throughout the night to help you sleep. Include medication available over-the-counter, prescription medications, and herbals. If every night is the same, write same after the first day. Comments. If you have anything that you would like to say that is relevant to your sleep, feel free to write it here. Contents covered for today's topic of subjective assessment of sleep. Key questions regarding sleep-related issues, outcome measures, sleep diary, the consensus sleep diary, morning and evening. I'm Chris. Hope that you've enjoyed today's topic of subjective assessment of sleep. This is Chris signing out.